power to quietly damage the nervous system from the inside out. It can speed up mental decline. It can look exactly like depression. It can be confused with the early stages of dementia. And the standard blood test doctors use to catch it will miss it in a meaningful share of cases. This isn't speculation. It's what the published medical literature actually shows. I'm talking about vitamin B12. Here's the frustrating part. The conventional test is fundamentally flawed. It measures the total amount of B12 floating in your bloodstream, but a large chunk of that circulating B12 is locked onto carrier proteins that never actually deliver it into your cells. So it shows up on the lab report. It counts toward the final number, but does almost nothing useful for your body, which means someone can walk into a clinic with textbook symptoms, get tested, hear that everything looks normal, and go home reassured. Not because anyone made a mistake, but because the tool being used isn't built for the job. I'm Dr. Wilson, and I've spent years working in acute and emergency care, and I've watched this exact scenario unfold with real patients. People admitted after a fall, people brought in confused, people who'd grown weak over time, and the underlying cause turned out to be a B12 deficiency that had been quietly present for years, missed test after test, because the number technically fell inside the reference range. That shouldn't happen, but it does more often than most people realize. Understanding why is most of the battle. So in this rundown, I'm going to walk through 11 warning signs that your B12 might be running low, including a few that rarely make it onto these kinds of lists. I'll explain what this vitamin is actually doing inside your body on a cellular level, why absorption failure, not just diet, is usually the real culprit, and which tests you should actually be requesting from your doctor. Vitamin B12 functions as what's called a cofactor, meaning it doesn't have just one job. It sits at the center of several essential biological reactions that simply can't proceed without it. Two of those reactions matter most when we're talking about deficiency: the construction of myelin and the replication of DNA inside bone marrow. Myelin is the protective coating wrapped around your nerve fibers, every single one, from the peripheral nerves running through your hands and feet, to the pathways coursing through your spinal cord, to the white matter inside your brain itself. This coating is what allows electrical impulses to travel quickly and cleanly. Without it, signals slow down, distort, and eventually begin to fail outright. B12 helps maintain that coating, and when levels drop, myelin starts breaking down, and that breakdown is the root of nearly every neurological symptom on this list. The bone marrow piece involves red blood cell production. B12 works together with folate to allow the DNA inside developing blood cells to replicate correctly. When B12 runs short, those cells can't divide the way they should. They become oversized, structurally fragile, and poor at carrying oxygen, a condition known as megaloblastic anemia. The resulting fatigue, breathlessness, and paleness aren't from blood loss. They're from blood that simply can't do its job. There's a third mechanism that deserves far more attention than it gets: homocysteine. B12 is required to convert this metabolic byproduct into a harmless compound called methionine. When B12 falls, homocysteine builds up, and elevated homocysteine is independently damaging to blood vessels and brain tissue, linked to faster cognitive decline and higher cardiovascular risk. So this isn't only a story about nerves and blood, it's a long-term vascular risk too. Here's something that surprises a lot of people. Your liver stores B12, and those reserves can last somewhere between 2 and 5 years. That means someone can develop an absorption problem today and feel completely fine for years while their stores slowly deplete in the background. By the time symptoms surface, the deficiency has usually been building for a long stretch, and in many cases, neurological damage is already underway before blood work shows anything abnormal. This is backed by a substantial body of research, including studies published in major medical journals showing that nerve damage can precede any detectable change in blood levels. On the subject of absorption, many assume B12 deficiency is mainly a concern for people who don't eat meat. That's not accurate. The majority of serious cases in adults over 50 occur in people who eat plenty of meat, fish, and eggs. They're consuming adequate B12. Their digestive system simply can't absorb it. The process requires sufficient stomach acid to release B12 from food proteins, followed by a specialized carrier protein called intrinsic factor that ferries it to the lower small intestine, where absorption actually happens. If either step breaks down, through age-related decline in stomach acid, prolonged use of acid-suppressing medications, or autoimmune damage to the cells that produce intrinsic factor, the whole pathway collapses. Someone could eat liver every single day and still become severely deficient. Now, the 11 signs. The first is fatigue, nearly universal in B12 deficiency and almost always misread as something else. This isn't ordinary sleepiness. It's a full-body heaviness, physical, mental, and emotional all at once. And a good night's sleep does nothing to fix it because the problem isn't exhaustion. It's blood that physically can't carry enough oxygen to tissue. People often describe it as wading through mud or operating at some fraction of their normal capacity. The ceiling on their energy drops so gradually they adjust without noticing how far they've fallen. The second sign is tingling or numbness in the hands and feet. This is the most diagnostically telling early neurological symptom, and one worth taking seriously. As myelin deteriorates along the long sensory nerves reaching into the extremities, signals become garbled. People describe pins and needles, numbness, or a faint buzzing or electrical sensation. It tends to appear symmetrically, both hands, both feet, and often worsens at night. This kind of nerve involvement is frequently mistaken for diabetic neuropathy or poor circulation, delaying an accurate diagnosis by months or years. Left untreated beyond roughly 6 months to a year, once these symptoms appear, the nerve damage can become permanent. It isn't just uncomfortable, it's a countdown. Third is unexplained muscle weakness. When tissue is chronically starved of oxygen, skeletal muscle feels it early, fatiguing faster, recovering slower, losing strength over time. There's also a direct neurological piece. As motor pathways lose their protective coating, signals from brain to muscle weaken. People notice general weakness, difficulty with sustained grip or effort, legs that feel heavier than they should. In older adults, this contributes directly to falls and loss of independence, and it's often dismissed as ordinary age-related muscle loss before anyone checks B12 levels. Fourth is balance trouble, especially at night. This is a more advanced sign, indicating the deficiency has begun affecting the spinal cord itself. A specific condition called subacute combined degeneration can develop, damaging the pathways that carry proprioceptive information, your body's built-in sense of where it is in space. As these pathways degrade, unconscious feedback from feet and legs is lost, making balance genuinely effortful. In a bright room, vision compensates fairly well. In the dark, or on uneven ground, the deficit becomes obvious. People notice they feel unsteady at night or find themselves watching their feet as they walk. This isn't clumsiness, it's spinal cord involvement, and it warrants prompt investigation. The fifth sign is a shift in mood, depression, or a kind of emotional flatness. B12 is essential for producing serotonin and dopamine, the brain's principal mood chemicals, and when levels drop, the brain can't manufacture enough of either. This rarely looks like textbook depression. More often it's flatness, irritability, or a quiet withdrawal from things that used to matter. People don't usually say, "I'm depressed." They say they don't feel like themselves. Crucially, antidepressants won't fix a mood problem caused by a missing nutrient, and research has shown people with low B12 respond notably worse to antidepressant treatment. Doses get adjusted, medications get changed, and the actual cause goes uninvestigated, sometimes for years. Sixth is cognitive change, brain fog, memory lapses, difficulty finding words. This is the sign that does the most damage when missed, because it can look nearly identical to early dementia. Slowed thinking, forgetting words mid-sentence, unreliable short-term memory. These stem from two things happening simultaneously: nerve pathways in the brain losing their protective coating, and rising homocysteine directly damaging brain tissue. Research has linked elevated homocysteine to faster brain shrinkage and meaningfully higher dementia risk. To be clear, B12 deficiency doesn't cause true dementia the way Alzheimer's does, but it produces symptoms that feel and look identical, driven by something correctable rather than irreversible degeneration. The danger is that many people with this presentation get labeled with dementia, told nothing can be done, and never have their B12 properly checked. When B12 is the actual driver, treatment can reverse much of it, a completely different outlook, and one that's being missed in far too many people. The seventh sign is a smooth, sore, or inflamed tongue, something you can check yourself in a mirror right now. Normally, the tongue has a slightly textured, almost sandpaper-like surface from tiny projections called papillae. When B12 is low, those projections break down because the cells maintaining them can't replicate properly. The tongue becomes smooth, shiny, often red and tender. Eating grows uncomfortable, taste can shift, and some people develop a persistent burning sensation that dentists and doctors can't otherwise explain. It often shows up alongside mouth ulcers. Easy to overlook, but a direct physical signal that something is wrong at the cellular level. Eighth is pale or faintly yellow-tinged skin, two things that seem contradictory but actually occur together. The paleness comes from anemia. Fewer functioning red blood cells means skin loses its usual color. The yellow tint comes from something different. The abnormal, fragile red blood cells produced during deficiency get broken down by the spleen faster than normal, releasing a compound called bilirubin that gives skin and the whites of the eyes a subtle yellow cast. Nothing like the dramatic jaundice of liver disease. Very subtle, but combined with fatigue and pallor, it's a pattern worth noticing. Ninth is heart palpitations or breathlessness with minimal exertion. When blood can't carry enough oxygen, the heart compensates by working harder and faster, producing a racing or pounding sensation even at rest. During physical effort, oxygen demand outpaces supply, and breathlessness follows. Standing up quickly, climbing stairs, walking to the car, none of these should leave someone gasping. When they do, and a cardiac workup comes back clean, anemia from B12 deficiency is a diagnosis worth actively pursuing. The 10th sign is changes in vision. B12 deficiency can affect the optic nerve the same way it affects nerves elsewhere. The protective coating deteriorates, signals distort, and vision shifts. This typically shows up as gradual blurring or dimming of central vision, or colors appearing less vivid than before. It's easy to blame on needing new glasses or simple aging, but in someone already showing other signs of deficiency, this warrants prompt investigation because optic nerve damage left too long can become permanent. And the 11th sign is disrupted sleep. B12 plays a role in producing melatonin, the hormone that governs your sleep-wake cycle, and research examining the connection between B12 and the body's internal clock suggests deficiency can disrupt sleep in ways that go beyond simple tiredness. People describe lying awake despite exhaustion, waking too early, or sleeping a full night and still feeling unrest. This feeds directly back into the fatigue, the mood changes, and the cognitive fog already described, a cycle that's difficult to break without addressing the actual cause. If several of these symptoms sound familiar, the biggest obstacle to getting real answers is the very test meant to provide them. Most labs only flag a problem below roughly 150 to 200 picomoles per liter, but research shows nerve damage can occur well above that threshold. One study published in a major nutrition journal found that up to 40% of people sitting in the low normal range have a genuine deficiency at the cellular level. Their tissues simply aren't getting enough, even though the number on paper looks acceptable. Someone at 240 or 260 gets told they're fine and sent home while the underlying damage continues. The two tests that actually catch this are methylmalonic acid and homocysteine. Both rise when the body is genuinely short on functional B12, regardless of what the standard test shows. Neither is run automatically. You typically have to request them by name and sometimes pay out of pocket. If your B12 sits below roughly 300 picomoles per liter and you're experiencing any of these symptoms, that's worth discussing with your doctor even if the number is technically within normal range. The highest risk group is adults over 50, since stomach acid naturally declines with age, and B12 absorption depends heavily on that acid. Anyone on long-term acid-suppressing medications faces the same risk for the same reason. Metformin, one of the most widely prescribed diabetes medications, is another factor. It's known to interfere with B12 absorption in the gut, and while there's guidance recommending monitoring for long-term users, it isn't consistently followed in practice. Anyone who's had stomach surgery or who has an autoimmune condition affecting the stomach lining also falls into a higher risk category. If anything here concerns you, ask your doctor specifically for 3 things: a serum B12 test, a methylmalonic acid test, and a homocysteine test, not just the standard panel, since we've covered why that alone often isn't enough. If a deficiency is confirmed, what happens next depends on the underlying cause. In most people over 50, the issue isn't insufficient intake. It's a gut that's lost the ability to absorb B12 properly. In that case, an oral tablet often won't help much, since it relies on the same broken absorption pathway. An injection delivers B12 directly into the bloodstream, bypassing the problem entirely, and your doctor can arrange this. For people on plant-based diets where the issue is simply insufficient intake, a high-dose daily supplement, often around 1,000 micrograms, can work, since a small fraction can be absorbed through a passive pathway that doesn't rely on a functioning gut. If the cause is pernicious anemia, where the body attacks the very cells responsible for absorption, lifelong injections are typically necessary. And if metformin is involved, addressing the supplementation and discussing the medication itself should happen together. A B12 deficiency ranks among the most treatable conditions in medicine. Caught early, recovery can be remarkable. Fatigue lifts, mood stabilizes, cognitive fog clears, nerve symptoms resolve. The nervous system genuinely can heal once it gets what it needs. But timing matters enormously, since every month a deficiency goes undetected is another month of accumulating damage. The test meant to catch this often falls short, and that's exactly why it's worth knowing the signs, requesting the right test by name, and refusing to accept a normal result as the final word when something still doesn't feel right.